Hi everybody, this is Dr. Robert Caridi from Westlake Plastic Surgery, and this will be a brief explanatory diagrammatic video answering the questions of the following. Number one, what is a bar procedure, my breast augmentation and reduction, and what's the difference between that and a breast lift with a breast implant? Anyway, so let's get to it right away. This was drawn by my little colleague here because I'm not as good as she is, and basically drew an example of a woman's torso. And really what I want to illustrate here is the long distance, let's say, between the clavicle and the bottom of her breast and the distance here of the abdominal area, because that's important parameters in determining who's an ideal candidate for a bar procedure. But anyway, bar, breast augmentation and reduction. So augmentation, we're going up. Reduction, we're going down. We're talking in terms of size. So you can imagine on a side view, if you have a big breast, usually the areola gets wide, the breast hangs. Okay, this is your crease, this is your abdomen. The upper chest up here gets flat because everything is just big and low. And so really what's great about the bar procedure is this. We're adding an augmentation, which is kind of not intuitive because you already have a big breast. Why don't you just deal with it? Well, the problem is you can't take saggy tissue and bring it up. It doesn't work that way. So what you're doing is you're adding a breast implant, okay, up over here. And so that breast implant is going to give you superior fullness. In other words, that's going to be fullness up in this region over here. You can imagine a fuller-breasted woman has these breasts down over here. And in this case, you have a lot of real estate on the upper part of the chest, and the abdomen gets shorter. And I know a lot of women that may be watching this video say, yeah, that happens. And it does. And the reason why is your breasts are setting too low. So what happens here is I'm going to reduce this area here, the part of the breast, for instance, that hangs low. I'm going to bring this nipple north or way up. And then from here, you can imagine I'm going to get a much more youthful orientation to the breast and a higher breast. So you'll have the implant here, and the breast will be up. You won't have a lot of this skin-on-skin ptosis. The nipple actually looks up, which is a good thing, right? And it doesn't look down, which is sad. We don't want sad. We want happy, okay? So up is happy, down is sad. This combination of a breast implant and a breast reduction basically lifts everything up and makes it any size we want, bigger or smaller. Okay. So that's my bar procedure. Now, a breast lift and breast implant is something you'll hear more about on the internet because this procedure here, essentially, was described by me, as far as I know. In other words, I'm the one who's popularized this bar procedure. I've done it for about 15 years, and it's really not commonly accepted in the literature. But suffice it to say this. The breast lift with an implant is essentially, you're not really reducing a lot of tissue, you're just tightening things up, and you're using an implant. And the problem with that is two things. Number one, tightening things, okay, really doesn't work with breast tissue. You can tighten it, but it just sags after a while. So in my case, you don't want to tighten it, you want to reduce it, you want to remove the tissue, okay? The second thing is that the situation of where your breasts are located, okay, down here, really doesn't change. So when you're putting in your breast implant with a breast lift and without the reduction, things just kind of stay where you are. So oftentimes what you get is just a bigger breast that maybe is a little bit better in some ways, but it's essentially a bigger breast that's sitting low, okay? With the bar procedure, basically things come up here. Okay, so you can imagine that what's great about that is that this area here shortens. So now when you wear a top or a strapless top, things are great. You got some fullness up over here, and things are not way down here. Your breasts are no longer, you don't have to pick your breast up and stuff them into your bra. Everything is up, and I call this the station of the breast. Everything is up, and it's a very powerful procedure. So anyway, that's just a quick overview of the difference between a breast lift and implant and my breast augmentation reduction procedure. Thank you.